Hi, my name is Rachel Lorenzen, and I want to talk to you about a thorough assessment when you go to the home to see a mental health client. So, we pull up into the home, maybe you're at an apartment, maybe you're at a single family house. I need you to look around. This is when the assessment needs to start taking place. Are there adequate parking spaces if the patient drives? Is there a way for the patient to get in the house if they're using a wheelchair? Is there a ramp? Is the neighborhood safe? Can you see immediate concerns as you're going in that need to be addressed? So look around. If it's a single family home, is the building itself in good condition? Are there things that you can see that are in desperate need of repair? If it's winter, do we have snow issues? Are you as a nurse or the patient able to get in and out safely? Are those things being addressed? If it's not the winter, look at the yard. Are there leaves? Are things needing to be done that this patient can't get done themselves? When we walk into the house, let's start with the structure of the building. Is it safe? Is it adequate? Is there electricity? Do we need to look at handicap accessibility factors like doorway width and things of that nature? So ask the patient, could you take a little look around and see what's going on? Let's move to the bathroom. Bathroom has a lot of places where things can go very wrong. So if a patient is experiencing any type of accessibility issues, bathroom is generally the place where we have the most issues. So let's look at the toilet. Do we need to get a raised toilet seat? Do we need to get grab bars installed so that's a bit safer? The shower itself, do we need a shower chair? Or is this patient completely incapable of using the shower and hasn't been using the shower because they need a roll-in shower? These are things that you need to be looking at. Let's move to the kitchen. Even if a patient doesn't have any accessibility issues, generally the kitchen can tell you a lot about the patient. Don't be afraid as a home care nurse to gingerly request to check out the refrigerator or the cupboards. Does this patient even have food? If they're a diabetic, are they having the right food? Do they have orange juice in the house? Do they have sugar, just in case there was a hypoglycemic episode? You need to think of this patient in a holistic manner and all of the day-to-day things that they're doing. Kitchens can be very messy, and when the mental health community, ADLs start to decline, and first thing to stop getting cleaned properly is the kitchen. Is the garbage getting taken out? Is the dishes being done? Do we have any type of infestation problems with cockroaches or ants? Look at those issues. When we look at the house as a whole, is the patient keeping it up? Is it clean? Do we have smells that we don't know where they're coming from? Do we have any type of hoarding issues going on? These are things that you need to address. Are the exits able to be safely accessed? If they're in an apartment, do they have a working sprinkler? Is the maintenance company coming to do the things that they need to be doing for this individual patient? So now that we've looked at the house as a whole, let's move on to the patient. So it's not just the simple things, right? It's not just a blood pressure and a pulse. These things I'm sure that you're going to be doing. You're going to be assessing a thorough body systems to be able to make sure you have a thorough medical history and evaluation to meet their needs. But we need to think of this patient in a holistic manner. And we need to look at them. Are they dressed appropriately? Are they dressed weather appropriately? Are their clothes clean? Are they doing their laundry? Do they have a means to do their laundry? Perhaps they don't have a washer and dryer in their home and they're not able to afford to get that done. Are they getting to their medical appointments, their psychiatric appointments, their therapy appointments? We have to think of all of the little steps involved in keeping this patient wrapped with services so that they can be independent in the community. If they don't have a car, are they using the bus? Are they capable of using the bus? Do they have a family support network that perhaps is helping them with transportation or with grocery shopping, errands, bill paying? Are they conserved? Is somebody stepping in to make decisions for them? Are they capable of paying their bills? Ask simple questions. I never bring a piece of paper into a mental health patient's assessment. I don't sit there with my computer on. I have a conversation. And I start by asking things like, how's it been for you? Um, has your parents been around, your sister? Start asking questions as a conversation and see where that leads to. What information are they going to share with you about their support system, their friends, their boyfriends? Are they in any type of abusive situations? The conversations that you create with people, just shooting the breeze, will get all of the information that you need. You just need to ask leading questions into the areas. And when you see that perhaps there's a problem in one area, try to investigate that a little further, but be careful. Don't push too much. Maybe you can't get all of the information you need with a mental health patient in day number one, and that's going to take time, and you need to build that therapeutic communication and relationship over time, but it has to start somewhere. It has to start with that first visit. So we're looking at, are they taking care of themselves? Do they have support system? Are they going to their appointments? Let's think about their medication. Mental health patients, the biggest thing is making sure that they're taking their medications. Without their medications, they can't be successful in the community. So are these medications being set up by a nurse? Are you going to need to set them up? Is a family member setting them up? Are they being set up correctly? Are they taking them from the bottle? You can't take the word of a patient. You need to look into it to make sure that these things are happening. Are they able to access their medications from the pharmacy? Perhaps they need to have home delivered medications. Do we have diversion issues going on? And it's not always the patient who may be diverting Ativan or Xanax or Klonopin. Perhaps that's the neighbor or the brother or the child. These are things that as a nurse you have to be aware of and look for the small signs to make sure that these things aren't happening, and then make plans within your care plan to address these factors. So we've gone through the person, we've looked at all of their ADL needs, we've looked at their house, we've looked at their medication. I know as nurses you're already going to look at their medical status, and we've talked about different things as far as the psychiatric assessment is concerned. So we've already started this assessment by looking at the way they appear, their thought process. Are they able to have a regular conversation with you? What is their affect like? What is their speech like? Are they guarded? These are the things that you need to be looking at. You need to be looking at the little signs. And unfortunately, you need to have some time to get to know them. Obviously, there's some things that are going to stand out. If somebody's suicidal or homicidal, if they're cutting, you'll be able to see the marks on them. These are things that you might be able to see right away, and obviously you'll need to address them immediately. But over time, you should be able to get to know a patient to be able to see the little nuances in their personality to see how they're doing. Are they sleeping well? Things of that nature. So basically from this video, I'm hoping that you can gain that an assessment is not cut and dry, and it's not all about a stethoscope and a thermometer. When it comes to the mental health patient, or really any patient in community health nursing, you have to start that assessment before you even walk in the house. And you need to know the nitty-gritty, and you need to think about the entire picture and every last bit of service that this patient might need to be successful in the community. But if you don't have a good assessment, then you certainly can't plan for the interventions to make their goals be reached, to make them successful in the community. So think holistically, and treat these patients the way you would want your family members treated. Thanks, and have a great day.